Hello, welcome. We are going to present our PowerPoint on building culture of health, community-driven approaches to health equity in Klamath County, Oregon. Slide. And then these are the presenters today. So I am Bianca Villalpando. I am the account manager here at Conduent Healthy Communities, and we'll dive into what Conduent Healthy Communities is in a couple slides. And my also co-presenter is Kelsey Muller Wendt, the foundation manager at Sky Lakes Foundation. And these are the objectives of the talk today. So for today, we are going to go over, just demonstrate how the CHA and MAP 2.0 methodologies have been applied to identify and prioritize health needs in Klamath County, share strategies for engaging diverse community stakeholders in health improvement planning and implementation, highlight policy, system, and environmental changes influenced by this coalition's efforts, and then discuss lessons learned and replicable practices for other rural communities seeking to improve health equity. And I'll give it to Kelsey to introduce the Healthy Klamath Network.
Hi, so my name is Kelsey Muller Wendt. As Bianca stated, I am the co-facilitator for the Healthy Klamath Network, and I've had the opportunity to do this for about 4 years now. I've worked for Healthy Klamath Agency for 7.5 years now. And what we do is we are a group of individuals and organizations that were formed in 2012. This was in response to community health challenges and a mandate at the state level asking all communities to do a community health improvement plan as well as a community health assessment. And fortunately, we had leaders in our community that sat at the table and said, we should do this as a collaborative effort instead of all individually doing different documents for the same end goal of having a healthier community. So that led to a multi-sector, community-driven coalition, which you now call Healthy Klamath. And when we say multi-sector, that is because it includes a variety of different backgrounds. It not only includes local government officials, it also includes churches or fellowship organizations, as well as schools and other affiliated organizations. We're focused on long-term sustainable change. And so what we have identified is that if things are not improving, we will keep working at them until they do. We want sustainable changes. And so you'll see as we explain how our network is set up, how we've tried to put in place some different sustainability practices to make sure that this is a long haul and not just a temporary project that may end when someone leaves the organization or someone doesn't want to do it anymore. As a result of this, we are a certified Blue Zones community. Klamath County was one of the first demonstration communities on the whole West Coast. And so we're very proud to be certified. That was a separate organization that did that, but it was all a part of the network's work within our community. Next slide.
Thank you so much. And I also represent Conduent Healthy Communities. So who we are. We are a community health data service and centralized platform organization. We started off grassroots in Berkeley, California as a startup. And the whole goal of the Healthy Communities Institute is to bring data and bring health equity at the tips of your fingers to help facilitate really good assessment and planning services. So we have impacted over 90 million lives with our work. We do work in 31 plus states, and we're also currently working in Puerto Rico as well. We have 18 plus years of experience in the community health field. And over 400 plus community health assessments and plans have been completed with the help of HCI. So, where HCI and Healthy Klamath meet is we have our Healthy Klamath platform. So, that is an online data repository of hundreds of indicators that tell a little bit more about daily life. So, it goes from health, economy, demographics, and so much more, as well as their community health improvement plans are on the site and other resources to help the community. So, this is how Healthy Communities Institute fits with the work, and it helps propel Klamath County's needs of making sure things are equitable and transparent for the public. I'll go into the next slide about who's at the table.
So, who's at the table is not only our local public health, but we also have our healthcare providers. We have schools and learning partners. So, that includes our early learning hubs, our migrant farm working population, and a variety of other people at the table. We also have a close partnership with our tribal entity, which is the Klamath County or Klamath tribes. And they're affiliated with 4 different regional tribes. And so, we're very honored to have them as a core partner as well. We also work with a lot of community-based organizations. We work from a variety of different places, such as our community, our child advocacy centers. We work with rehabilitation services, substance use services, you name it, we work with them. We also have the opportunity to work with government and business partners. So we don't only work with community-based organizations or non-for-profits, we work with our government and we try to partner with businesses that feel applicable to our mission, which is creating a healthier community. And how this overlaps a lot with the Conduent thing and working with Conduent is that we have the opportunity to have what is illustrated on the right-hand side here, which is considered our core 5 partners. So our core 5 partners are established because they help pay for Conduent as a service. And we all find it very valuable because a lot of us apply for grants or we have reports that we have to keep compliant on, and Conduent really helps us with that. And so we partner as whether it's financially or with staff time to provide what is the backbone for the Healthy Klamath Network, which is included in staff time, marketing, as well as the website, which is healthyklamath.org. Next slide. So as discussed previously, we do perform what is called the Community Health Assessment. And on the left side, you'll see the latest one, which was done in 2024, which feels like we just did it. And we're ramping up to do our next one in a year, which is so crazy that it's already happening. But what our Community Health Assessment does is it provides a shared understanding of what the community's health looks like. It not only looks at, specifically, chronic illness rates or heart rate. It also looks at the built environment. It looks at the physical activity rates. It looks at even workforce, and it also looks at our economic vitality. We try to touch on every aspect of socioeconomic status so that we can understand the full picture and the full realm of what the health looks like in our community. We do combine this data with quantitative and qualitative data. We perform what is called the MAP 2.0 methodologies, which I will explain a little bit more about later in the slides. Oh, sorry. But this community health assessment also helps guides our strategic priorities. And once this community health assessment is developed, we then develop what we call the community health improvement plan. Next slide. So our MAP 2.0 process is developed by our partners at the state level. It is something that is a several step process, and this is just a glimpse of it. So we do what's called a community partner assessment. What this does is it looks at all of our different partners and what they're able to do, how we can improve our health through the work that they're doing, and also it helps us assess our health equity and how we're attacking any type of nuances that might be present. We also do a community status assessment. So this helps provide a picture of our community's health, and we do this through data collection. Specifically, we use all of our HCI data that Bianca mentioned earlier. And then we also do a community context assessment. So this is where we are going out into the different parts of our community. And Klamath County spans almost 6,200 square miles. And so we have a lot of different municipalities that we service for our hospital district. Our hospital in Klamath County provides for over 10,000 square miles. And so being in these smaller communities and understanding what the current status is, hearing it from peer to peer is really critical data for us, even though it's just a scratch on the surface of what people are experiencing. But our context assessment, I would say, is the most impactful because this is where we really get to the root of what people's experiences are, how the system end users are experiencing their services, and what changes need to be happening, and where the gaps are in communication. Next slide, please. So our engagement methods are various and broad because we have to adapt on a regular basis depending on what the response mechan and what the response are. So we do community listening sessions. This is kind of what I was talking about on the last slide. So this is our opportunity to ask core questions to each different community. We also look at cultural groups. So we work with our Hispanic Health Committee, and they work specifically with our Hispanic population, and they do a whole listening session in Spanish so that we don't miss out on any information. Um, we work with our faith-based communities so that we can understand what's happening in those different realms. And then we also go to our senior centers, our smaller municipalities, like I was saying, and then we'll even hold sessions with firefighters, and we'll hold them at fire stations so that we really try and get a full picture of what's happening and what they're seeing. We do provide food at all of these listening sessions because we're really hoping that people come and attend because there is power in numbers. And one of the funnest way to share your story is over a meal, and we truly believe that. So, um, and then for our quantitative data, we do use surveys and feedback tools. During COVID, unfortunately and fortunately, we actually got the best response rate we've ever received for our community health assessment. And it was because we went to COVID testing sites, which I know sounds super dangerous, but it was for the power of public health. And so it was actually a really good turnout to understand where people were at. This last time around in 2024, we did not see as good of a response rate, but it was because we didn't have the opportunity to meet with really large groups. And they weren't sitting there waiting for their turn to get screened or to get a vaccine. And so that was a really great opportunity for us to understand where people were at. For this last round, we went to community events. We would stand at what's called Third Thursday, and that's where the whole community gets to come out to our downtown, and we got hundreds of surveys. Our threshold was 500, and we were just below that. And so we feel that our surveys are a relatively good mechanism for understanding what the health is. But again, using that HCI data is critical for us. Um, and then we also do work groups. So what these work groups are, they are developed by the community health assessment. So it's kind of decided on what those work groups will be focusing on through the outcomes of our community health assessment. These work groups are led by community members, but we really try to emphasize that these are built within people's roles within the organizations. And so a lot of times when we are highlighting a new health concerns such as behavioral health, we will try to bring in a behavioral health partner. That way, there's longevity, there's sustainability, and it doesn't feel like it's more on someone's plate than what's already expected of them. As I'm sure a lot of people can relate to in a rural community, you wear many, many hats. And so adding one more hat can be a challenge. And so by partnering with organizations that do focus on these things, we're able to have a broader reach and have more sustainability, as well as a stronger partnership in areas that might not be focused on in previous times. Next slide, please.
Thank you so much. So, what we go into next is healthyklamath.org, which is the data website geared towards indicators regarding social determinants of health. So this is an example of a dashboard that we have. And these are public-facing dashboards that give insights to what the community is currently experiencing. So as you can see on the right-hand side, we have the dashboard or screenshot of the dashboard with social determinants, and then we have a couple categories. So you can see health and disability, healthcare quality and access, and healthcare information technology. So with these dashboards, again, with helping the community get data at the touch of their fingers, they can see indicator, which is a little slice of information, a metric that's showing them more about the community itself. You can see the value. So for the first indicator, it's 35.2. And then the most powerful tool is the comparisons. So we can see how the county is faring compared to the state of Oregon, the other counties in Oregon, US counties, US values, and also trends over time. So that is something that is very nice on the dashboards that people can look at multiple points of interest and multiple indicators. Um, at just one glance. And these indicators, especially in the social determinants of health, are used as some of the foundations in helping propel the CHA and also seeing which priority areas to focus on next. And I'm going to go over some of the priority areas that we have for from that 2024 CHIP and CHA. The priority area, this one is access to service. So we can see here adults who have had a routine checkup. We see the value by zip code. And another nice feature on the Healthy Klamath platform is you can see by different geographies. So we know what the county value is altogether, but we can even peel that layer step back and look at things at the zip code levels. So we can see which zip codes, like this one highlighted in the graph, the 97601 value is a lot higher than others. And then you can also see just the different groupings. So that darker blue is telling us this is a little bit less of a value. And then that lighter blue is telling us which values are a lot higher. So you can see where geographies are ranked as well on the platform. And then that can also help with action planning and resource planning to see which zip codes might have greater need. And typically, this data also corresponds with the CHA. I'll go on to the next priority area, an indicator. So the next priority area was behavioral health, and this is something that's been a priority across several CHA cycles. So here we can see one that's highlighted, and this one is also on the homepage of healthyklamath.org, which is Poor Mental Health Days 14 plus. So we can see for the county's value, it is at 18.7, and it is in the red. So that red where the gauge just means it's in the worst of the 25% of the counties in Oregon. We can also see that it is in the worst 25% of the distribution across the US, and then it is worse and higher than the single US value. So what this data is showing us that we know that behavioral health is a priority, and we know that we must improve the mental health of the community, and these data help pinpoint how we're faring across the county and across the region. So I'll go on to the next one. So the next priority area was food security. And food security is something that will be discussed a little bit later in the presentation, but Klamath County has done wonders to help address with so much of their food banks, their mobile food services, and a lot of the community events that they do have. So with this, I chose one indicator to show the food insecurity rate. For this time period, which is 2023, it is a 17.5. And you might think 17.5 might not be a lot, but let's look again at the comparison. So again, we see compared to other counties in Oregon, food insecurity is really high, as well as compared to other counties in the US. So that does tell us that there is something that we should look at. And of course, the data and lived experiences are what help bring wonderful insights and help propel more public health action. And then we can see here, which is something I do want to show you at the gauges, it's worsening over time. So they're looking at it from previous years, and we can see that there is a slight uptick in food insecurity rates. And I will go on to the next one. A little insight about the data. So the last priority area is physical activity. And if you haven't noticed, a lot of these priority areas are interconnected. So access to services, behavioral health, nutrition, and physical activity, they all correspond to living a healthier life and also having a healthier community. So we can see here that there are certain targets. So we have the Healthy People 2030 target that it doesn't meet, but it's not too far off. And then we can also see here that for the county value, it is 22.4. It is in the yellow, so it is not in the worst quarter of across Oregon counties, but it's in the yellow, meaning it's right in the middle. So that shows you that, okay, we're not in the best percentile, but we're also not in the worst percentile in terms of adults engaging in physical activity. And then these indicators also help us inform what actions that we should do next or what public health programs we should implement next. And Klamath County does wonders in promoting healthier and more active lifestyles across their newsletters and other different activities. So I will move forward past that priority areas and what the data is showing, and I'll give it to Kelsey to talk about community engagement.
As Bianca was saying, we do a lot in our community engagement realm because without engagement or communication, we would have no opportunity to try and work with individuals to try and help the health outcomes. So we have a variety of partners that do a really wide range of services. One of those things is resource markets. And so we partner with Cascade Health Alliance, and they provide what's called a resource market, and this is just an outreach opportunity for people to have closed circle services. So when they're referred, how is that? What's the loop? What's that feedback loop look like? Are they getting feedback? Are they getting services provided? What's that end result? So that's a really helpful thing that the resource provides. And then we also work with the food bank on doing things like the produce connection, or we also have a monthly newsletter where we work really hard to make sure that we're getting out information about what the various different things happening in the community are and what services are available and what resources might be available up with coming coming soon. We also provide a community calendar. This is updated on a weekly basis, sometimes even more, depending on how busy it is or what events are happening. And for us, summer is very engaging. And so this is updated on almost a daily basis. And so this is where we'll update things like summer lunch programs, summer food programs. We also provide free community fitness classes, and we do something called Give Back Day, where we help work on different projects that might be lacking in volunteer database. So we really try to engage the community by having a central location, which is housed on healthyklamath.org, and it is our community calendar. We do host events such as Give Back Day, like I just listed. We also do a Bike to Work Day to try to get people physically active. And then we host community meetings every single month. And a lot of times those events are really trying to focus on providing resources, giving an opportunity for community partners to present what they have going on, and much more. We also pay and provide a volunteer database called BOMO. This is a newer edition, so it's not as robust as previous volunteer databases, but we feel like this is a huge asset just because when people are given the opportunity to volunteer, it does increase their life expectancy as well as their community engagement. And it gives us an opportunity to partner and engage with them a little bit more on a different level, rather than always just saying, hi, we're here. It's how do we engage together and work together. So these are a few of many community engagement approaches that we take. But yeah, next slide. So we really try to do what we would consider a systemic change. So we work in policy, systems, and environmental changes. And what that means is we work to make policies that make sense to make either tobacco less accessible. We also work to have long-term sustainable changes through systems changes. So an example of that is, providing more vacation time to those that don't smoke. So people that aren't taking a 15-minute break, they get to count that as a walking break, or they can take that time and do whatever feels right for them. We do a walking break at the Healthy Klamath office. And so instead of going out and what used to be considered a cigarette break, we take a 15-minute break and we go and walk laps around our office, or we walk around the downtown corridor because that's where we're located. And so these are some different policy changes that workplaces can adopt to try and help their physical health of the individuals. We also do county level advocacy or state level advocacy. We partnered with our county commissioners to advocate for raised ages on tobacco sales to be 21 rather than 18, and that was successfully passed. We also have worked with our commissioners as well as city council to provide buffer zones for tobacco retailing licenses. And so what that is basically if you're within a quarter-mile radius of a school, you cannot get a tobacco retail license unless you've been grandfathered in or already had one. But once that sale of that business happens, they can no longer sell tobacco if they're across the street from a school or within a quarter-mile radius. So things like that that really do try to improve the public's health. And it's not to take choices away, but it is to provide a safer environment for our kids and to not have as many underage tobacco users. So those are a couple of examples of how we've worked really hard to do policy changes. Some environmental changes that we've done. We work really hard in the built environment world as well. We have had the opportunity to help fundraise for ADA accessible playgrounds that we actually do have like a wheelchair swing, and we have a merry-go-round where wheelchairs can lock in place. And we also have a port in place rubber surface that anyone with a walker or a stroller or a wheelchair can roll onto. So these are really important environmental changes that we feel do help with the physical health of individuals as well as the mental health, because they have opportunities to get inside, outside, as well as to build those fellowships and relationships with other children and to do activities that maybe they weren't able to do before. So we do really try to do those environmental changes so that it does help long term for those individuals to live a better lifestyle. We also work on bike infrastructure or wheel infrastructure so that strollers are more accessible on sidewalks, or having buffer lanes for biking and providing more space for individuals that may have to use wheels for assistance to move. So we work on those different types of environmental changes as well. We also do beautification efforts. So we have done several art installations. There's a lot of research that supports that art does help with mental health. And so we have worked really hard to make beautiful spaces where people can spend time, whether it's meditating or just getting outside. And so all of these art installations are outside so that people have the opportunity to enjoy them no matter what time of day. And those are just a few glimpses of the different things that we've done as far as our policy, systems, and environmental changes that we've worked really hard for. One last thing I do want to mention is that we originally, so with our last community health assessment, we did have a focus area on equity. And so with that focus group, they were essentially in charge of making sure that every work group was focusing somehow on equity, whether it was developing an equity lens or interweaving it throughout their entire plan. What we've decided was that it makes the most sense to just have equity built into every single work group. So now, instead of having a separate work group, equity is applied to every level of work that we try to do. We try to make everything as accessible as we can. We try to meet people where they're at, whether that's driving an hour to get to where they're located, or if it's providing little listening session or little listening buds so that they can understand and it translates whatever we're saying to the language that they can understand. And then we also do a variety of different types of materials. So we do everything translated. If it's posted for public health, they translate everything in Spanish. And then we are trying to work towards more accessible items on our website. So those are a few things that we do in the health equity realm as far as interweaving it throughout our practices. Next slide, please. So we try to drive towards measurable impact. And so with that, we do ask that our partners do take a part in our community-led initiatives. So 80% of our partners take part in our community-led initiatives. What does that mean? That means that of the people listed on our website or that come to the table, 80% of them are taking on active parts of the work. They're not just attending a meeting, they are doing the work. They are going out and delivering lunches. They are translating, resources. They are helping with website maintenance. They are helping at Give Back Day. It really is a wide range of ways that people are helping. But we do ask that everyone has an interactive part of the work being done in our community. We've also expanded all of our resources to be in Spanish and English. Like I was just saying, we don't post a flyer without it being translated. And so we really try to be mindful of our community and those in it. And Spanish is the second most used language in our community. And so that is why we prioritize those two. And then we also were the recipient of the Robert Wood Johnson Foundation's Culture of Health Prize, which we are very proud of because what kicked off Healthy Klamath was that we were the second most unhealthy community in the state. And so we really tried hard to become a healthier community, and our needles are still not moving quite as fast as we'd like, but it was nice to get recognition for the work being done. And then, as I stated earlier, we are also a certified Blue Zones community, Blue Zones project community, meaning that we have made the changes to be what is considered an exemplary Blue Zones community, showing that we have workplace policies that help make healthier people. We have lowered our tobacco rate. We have increased our access for physical activity, and we have also increased access for fresh food. So again, we have not totally moved the needles, but we have made strides towards a healthier community. And then most recently, we were named a Foster G. McGaw Award finalist. We will find out if we are the winner in about a month. Next slide, please. So some of the lessons that we have learned is that authentic engagement takes time. We have built this for years. We have been in place for 14 years now, and it has taken consistent engagement as well as genuinely caring about our community. This is not the job that people take to become millionaires. They take this job because they're passionate about their community, or they're passionate about the outcomes of our individuals that live here. And so it really, everyone on our coalition is authentic, and they have had a huge hand in building up what we consider the network now. And we consider flexibility essential, an essential part of our work that we do. And the reason I say that is because as leadership changes happen in a rural community, it can either make or break your work. We've seen a ton of changeover in our leadership, and what that has done is built resilience because we've been able to put succession plans in place. We've formalized agreements because what was just a handshake deal between leaders has now become a formalized committee that provides deliverables that are measurable and that people actually see the impact of what we're doing. So these are some of the things that we've learned along the way, and we've kind of had to retroactively do. Again, like formalizing agreements, having roles built into job descriptions, and that way if someone leaves, the work can still go on and it's not dependent on just one person. Next slide. So some replicable practices that you can do is we do consistent network meetings. We do every single month on the fourth Thursday, and we provide meeting minutes that are accessible to the public. We post those on our healthyklamath.org website, and we try to provide as much information as we possibly can. We do shared workload through guided work groups. So we spread the work. Many hands make light work. And so we believe in that wholly. And that is why we have our work groups that are split up. They have their tasks. They develop those plans themselves, and then they get to execute on it with measurable impacts. So we find that having work groups guiding the work is much more impactful because they are the experts on that matter, and they have the ability to connect with the community that we may not be able to as the agency or as one organization. So again, many hands make light work. And then we implement what is called the MAP 2.0 methodology, which I've already kind of walked through what the process is for that. That is mandated by the state for accreditation so that we can utilize our organ health plan reimbursements, but it's also a great example of how to engage with your community partners, as well as understanding where your community's health is at in that moment, in that time, what is impacting that. So the MAP 2.0 methodology is not just a box to check, it's actually a really great resource to be able to understand where your community is at with their health and what the context of that is, as well as getting that qualitative and quantitative data. So we find this super helpful, and it's also kind of prescriptive. So that's what's nice about it, is that you can actually take the training to be MAP 2.0 certified, and you can get a binder that tells you how to perform this type of assessment, which we do implement and we have been implementing for, I think, our last 4 cycles. We've done MAP 1.0, and this was our first time implementing MAP 2.0. Next slide. So different tools for local health departments, a practical CHA, so a practical community health assessment. What we mean by practical is that it makes sense. It aligns with your partners. Again, many hands make light work. And so with our community health assessment, we reach out to our different partners and we say, what is required for your accreditation? What is required for your needs for your organization so that we can make sure that our community health assessment is meeting the needs of multiple organizations and not just one. So we really find a practical community health assessment super helpful because it's not just a document that sits on the shelf and collects dust. It's something that people are using on a regular basis and are actually putting into practice. And we use the MAP 2.0 methodology to do that. Our community engagement techniques, it takes a really long time to get people engaged and to really build up your database of people that are listening and that are engaging in what you're doing. But consistency matters, and people will know where and when to look so that your engagement will go up. And then equity-focused planning strategies. We have really tried to integrate equity into every piece of work that we do. And this is because when you're thinking of who you're trying to target, a lot of times it's people that may not have the same access to the same resources. And so when we are trying to, improve food access, we need to make sure that it's equity focused because we want it to be culturally appropriate, and we also need it to be accessible for those depending on what their needs are. So that's just one example, but we really try to focus on equity in every level of our work. And so we do this through our planning. And when we develop our community health improvement plans, we have equity applied to all of it. Next slide, please. So some of the things that we would consider our key takeaways is that our community members are co-creators of solutions. So our community members, if they are bought in, if they are a part of the process of developing what those solutions look like, we see a lot better outcome. And the reason we do that is because when people are gathering together, amazing things can happen. And if everyone is a co-creator of a solution, then they're more apt to actually get on board. And so they also, more minds are better than one when it comes to solutions oriented around the community. Equity-driven approaches improve outcomes, and that is because when you're able to meet people where they're at or to provide what is needed for individuals, they're going to have a better chance of seeing those improvements. So by having equity a part of every realm, we're able to see more positive outcomes because it's not a one size fits all. It's meeting everyone with what they need where they are. And then rural communities can drive meaningful change. We, again, are not perfect. We have not seen the needle move as much as we would like, but we have seen meaningful change. And we've seen a huge turnaround on the attitude towards health in our community. And I think that in of itself will have a positive impact long term. Next slide, please. So that's a little bit about Healthy Klamath Network and what we do. Thank you so much for the opportunity to present and talk. And sorry if I stuttered, but thank you so much for listening. And thank you, Bianca, for being a wonderful co-presenter. And if you have any questions, send us an email.
Thank you so much as well.